Hello, everybody. This is Dr. Anthony Cave, a Stanford and Harvard trained board certified anesthesiologist and integrated medicine specialist. I hope everyone had a good holiday weekend. And I wanted to share my thoughts after reviewing this terrible case from UC San Diego that many of you may have seen in the mail. I got a couple emails already asking me about what happened with the addict doctor that seemingly didn't give enough anesthesia to a patient who then woke up during surgery. So not only is this really scary sounding, like how could somebody not give enough anesthesia to a patient to then wake up in the middle of major surgery and then develop horrible PTSD, but then this same patient also not wanting to ever have surgery again, despite needing surgery and suffering all the health consequences from that. I see people coming in here. I hope everyone can hear me. Let me know if there's any issues with the sound. And while we talk about the addictions in this case with this anesthesiologist who underdosed possibly the patient, we'll also talk about the hidden addictions that we all have and what we need to know. The point here isn't that there should be fear about, the concern isn't that there should be fear about your doctors underdosing you and your doctors being addicts, because that's actually quite rare. We'll go into the stats in just a moment. But the bigger question is, what other addictions do we all have that might be hidden in our daily lives, that are revealed in stressful situations? And how can we use those revelations to help us overcome those addictions to things like anxiety, to things like depressive habit loops that are actually causing incredible suffering that we might not be aware of in our everyday lives, because a lot of these addictions are hidden. I see people hopping on here. Fayart, nice to see you. Photocan, and of course, Christy. About your channel, Christy, I'll absolutely help support what you do, no questions. So let's jump right into it. We'll answer questions after I talk about this case. I did review it from what's available in public domain about a patient coming in for spine surgery and seemingly being underdosed. Remember that whenever anyone has anesthesia, it's always this balance between getting enough anesthesia to cause amnesia and to be asleep, and not giving too much that'll turn off all the nerves in the body, the heart, of course, and the brain, all over the body. If you give too much anesthesia, you will die. Case closed. So it's always this balance of keeping you in this medical coma to undergo surgery safely. If you don't get enough, though, you run the risk of maybe being awake or maybe having parts of your brain be awake. You might not have full memories of what's going on. And this particular patient described a nightmare, and they didn't even know what they were experiencing for the longest time until they pieced it together over time. I'm just looking at Karma and Mochi here, as always. Yeah, hi guys. Causing mayhem when I try to go live. But back to what we're talking about, this balance. The problem here is that the anesthesiologist in charge, Dr. Bradley Hay, had been a known opioid abuser for many, many years. Whether Dr. Hay was impaired at the time, or the nurse anesthetist that was also involved with the case was impaired or not delivering enough anesthesia, we don't know. I don't have to actually have access to the medical record of what happened, but there is a lot of concern that somebody who might be impaired doing such a mission critical job might possibly be underdosing anesthesia. Now, this addiction was to fentanyl and to sufentanil. A lot of people don't know what sufentanil is. You've heard of fentanyl, an incredibly powerful synthetic opioid that we use in many surgeries. Sufentanil is actually much stronger than fentanyl. We use it in the operating room for certain surgeries because it has a very short half-life. We can use it as an infusion. It has less context-dependent half-life for chemistry geeks out there than fentanyl does. Not as short as remifentanil, but sufentanil is something in between. It's much cheaper than remifentanil, which is why it's used for many long spine cases. That's what this patient was having, spine surgery. Possibly, when Dr. Hay was found passed out after the case, it was suspected that he had sufentanil in his system. It may have been from sufentanil that should have been going to the patient during the surgery that may have helped keep them asleep. We really don't know those specifics because there are so many medications that contribute to hypnosis and amnesia, aside from just sufentanil alone. So just taking sufentanil, aside from being incredibly wrong and unethical, might not actually be responsible for this nightmare, this PTSD in the patient, but is absolutely wrong. And the point that I want to get at is that this represents an extreme form of addiction. The definition of addiction you all need to know, because we are all susceptible to addictions. Maybe not this severe and this completely just out of left field and criminal, but still small addictions to things like depression and anxiety. And the definition is so simple for such a complicated condition. It's having a process of short-term gain at the expense of long-term harm without being able to hit the abort button. That is addiction in 12 words. Short-term harm, long-term gain, can't hit the abort button. You can ask yourself, what are we addicted to? I mean, of course, things like food, sex, porn, gambling, all these things don't even involve other substances. But absolutely, when you have anything that gives a dopamine rush to your brain, especially a rapid dopamine rush, you are at the risk of making your brain dependent on that process. Why does this happen with IV medications? It's really important to know the difference here. Anything that overwhelms your brain suddenly overpowers your brain's ability to not become addicted, because our brains have always had the potential for addictions ever since the beginning of humanity. That is not new. What is new is having routes of access to give chemicals to the brain to overwhelm it very fast. Things like social media, online gambling, rapid dopamine rush, processed sugars, rapid absorption causing spikes in sugar, dopamine rush. And you guys can't tell my ringtone. This one in particular is from, well, whoever tells me where that ringtone is from, I'll give a massive shout out to. So I'm going to look carefully at the comments. I want to see who is going to tell me what that ringtone is from. By the way, Teresa, Catherine, YIMDMB. Good to see you all. Now, IV medications overwhelm the dopamine system even faster because they immediately go into your bloodstream and immediately cross your blood-brain barrier. Boom. They overwhelm your brain, just like if you walk into a dark room and suddenly turn on the lights. Everything, your brain cannot respond to all those lights being turned on. It takes like a second. Everything goes woof, and then you can see images resolve around you. That's because the lights turned on so fast from a dark room that boom, your brain needed a second to just like get back together. By the way, Jay, that is not from Star Wars, but good guess. I have actually many other Star Wars ringtones. That one is not, though. So, hey, Paul, I'm so happy to hear that. And Catherine, you're absolutely right. Video games are also entirely unnatural when you look at the history of humanity. We never have things that can so quickly give us that sense of pleasure. No surprise that people are so susceptible to addiction, in particular the young developing mind. So we talked about sugars, right? It's like literally almost like crack. Why is crack made into like snorting? Why did they make it made into snorting? Why is it finely crushed? So when it's snorted, right, it gives us a rapid dopamine rush, just like refined sugars. By breaking it down and processing it so finely, allows the glycemic index to go through the roof. Any diabetic knows this. It gives your brain a rapid dopamine rush. Overwhelms your brain, just like when you turn the lights on in a dark room. What does this have to do with us? So we talked about for fentanyl, sufentanil, of course, these things are going to rapidly overwhelm your brain's defense mechanisms to any addiction. But what happens to us? I mean, hopefully none of us use any of these highly addictive substances, but we have addictions, what they call hidden addictions, to other not only chemicals, but thoughts, addictive to maladaptive behaviors. What does that mean, right? We have adaptive behaviors in life and maladaptive behaviors. Adaptive behaviors are like, hey, you're in the savannah, you see a lion. What does your body do, right? It has that fight or flight instinct. Your sympathetic nervous system revs up, your pupils dilate, blood flow to your muscles improves, and your heart rate increases. You're mobilizing energy, glucose, etc., so that you can run away from that lion. Adaptive behavior. Maladaptive behavior is like you're about to give a speech and those same symptoms come up or those same signs come up. And it's like, well, that doesn't help you give a speech any better. Some parts of it may. We can't say it's all or nothing. But for the most part, that adrenaline rush probably does more harm than good in many of these cases, especially when it's done chronically over time. Then we have the risk of all sorts of heart complications, or I should say cardiovascular complications, possibly neurovascular complications, etc. So it's a matter of the context being wrong between adaptive and maladaptive. Especially a lifetime of maladaptive behaviors can lead to major medical conditions that I see in so many of my patients. But the issue is, how are we addicted to maladaptive behaviors? I'll give you some of the most common examples that I find in my patients and in myself sometimes. And those are things like, Doc, I can't eat healthy. Or Dr. Kave, can you please give me more pain medication because I always need more? Or Dr. Kave, I always wake up really nauseous. I always have a problem crying after surgery and anesthesia. Remember, I'm an anesthesiologist. I see patients in their most fearful, stressful states. That's when our addictive patterns are more likely to show. We don't rise to our best in stressful scenarios, we sink to our worst. The number of times, just myself, a couple days ago, I'm like, I just can't get any work done with Karma because she's driving me nuts. Well, aside from being self-fulfilling prophecies and being rigid mindsets, rigid cognitive distortions, these are setting ourselves up for failure, but they're also revelations of our habit loops. Where does our brain go to when we're stressed out? Unfortunately, in many of us, myself included, these can go to maladaptive habit loops. When we get stressed out, how many of you heard of someone who lashes out at somebody when they get stressed out? Or they begin to be really mean, be a jerk because they're stressed out. No pets right now, Karma. Sorry. Not being a jerk, just doing other stuff. So our habit loops kick in when we're stressed. And depends on what we've trained our habit loops to be. And that's what's ultimately revealed in these stressful scenarios. Remember, this is one of the most important things. Karma, she wants to play fetch with her right now. Yeah, there you go. Can't get a break here. So it was one of the most important things that one of my attendings told me on my ICU rotation back at Stanford a long time ago about when you have to practice, you have to have what Dr. Jed Brewer describes as a bigger, better offer. You need to train your brain to have a habit loop that easily kicks in stressful situations. When we're in the operating room, we have to know how to run a code like that in our sleep, because if something happens, we can't be a deer in headlights here and just let the patient die on the table, right? We need to have a backup system that kicks in very, very fast. In the operating room, it's knowing how to run, CPR, epinephrine dosing, et cetera, running a code to treat the dying patient. But what about, we don't live in an operating room. I get that, right? How about when I feel stressed, instead of taking rapid, shallow breaths that I know encourage the sympathetic nervous system to rev up even higher, my habit loop is that I actually take 3 slow breaths to reverse the sympathetic surge that's about to come. Or when I catch myself saying, like I said the other day, I said, I can't get any work done with Karma because she's just driving me nuts. Instead of repeating that in my head, that habit loop that causes anxiety can, if left unchecked, lead to depression. If left unchecked, can worsen chronic pain. No question at all. How about I feel like I can't get this work done? That is the goal. If you guys can take one thing away from our live today, and we'll get to your questions in a minute here. If we can separate ourselves from the hole we've been digging ourselves in through the words we use, the thoughts we choose, etc., that is one of our first steps. In addition to recognizing those habit loops, like me saying, like my loop is like, I can't do this, I can't do that, she's driving me nuts. Recognizing it. And then acting, and all it takes in the case of the words, when I say it, when my patients tell me, Doc, I always wake up with pain, I'm like, hey, I will treat your pain in the moment. I will give you all the medications you need. I want you to take a big deep breath and have trust that we are all here. You are the most important person for us in the world today, at least for this surgery, right? Until the next patient. And we're going to do everything in our power to make sure that you don't wake up with pain, with nausea, etc. But I want you, as you're falling asleep, to one, embrace the trust and compassion that you have for us and that we have for you, and to notice what you're feeling instead of, if you will, giving in to that feeling. Instead of knowing you're in pain or feeling like you're in pain and you can't get out of the pain, noticing that you're having the thought that you're going to wake up in pain. That's the transformative thing that helps. I mean, in my ketamine infusion clinic, it's what helps patients in that dissociative state disassociate themselves from those cognitive distortions. Helps them better recognize what are these hidden addictions that they are just living their lives circling in. Only by lifting ourselves up and separating ourselves from the circumstances can we begin to look back and to act on them. And it all starts with a bigger, better offer, like Judd Brewer says, in the case of what we said earlier. Instead of falling into that loop, the bigger, better offer is maybe taking a slower breath, maybe changing the words you use, et cetera, et cetera. So we have so many questions here I got to catch up with. Nobody here knew what the ringtone was, by the way, so I'm a little bit saddened by that. Jay had the closest Star Wars. It was not Star Wars. But whoever does get it, I will give you a shout out. And by the way, Nadia, it was not Mario either. Not Mario. But you're on the right track. Catherine talked about video games causing addictions. Absolutely. Nadia is from South Africa. That's fantastic. PhotoCan, we talked about adaptive behaviors in terms of procreation and sex. There's a difference between sex being an addiction and sex being an adaptive behavior. Remember, we said addictions are short-term gain, long-term harm without the ability to hit the abort button. So when people are addicted to sex, they cannot function without going prostitutes, et cetera, sometimes because they just have an urge that they cannot stop, even though it might be destroying their personal life, their professional life, et cetera. Maybe their health, if they're getting STDs from an addiction to sex. Very different than the procreation like you're talking about. Jay, can anyone overcome an addiction like that, or will they need Suboxone? Jay, addictions can be overcome. They're not easy, and it depends on the patient's history. Depends on the substance, depends on so many factors. However, I will say that we need to always remember that patients can wake up from surgery and quit smoking cold turkey. Nicotine is one of the most, if not the most addictive chemicals known to humankind. The fact that it can be overcome cold turkey after anesthesia, after a psychedelic-like experience, I think is very empowering for what other addictions or how other addictions can be overcome as well. Very good question. FireMed Chick, anyone can overcome addiction. It's whether they actually want to and whether the proper treatment is available. FireMed Chick, I think I agree with what you're saying. I do want to make sure that we're not blaming any patients here. And I know you're not, but it is something that's within our responsibility to want to overcome. Right? We have the responsibility to wanting the treatment. Like Hippocrates said a long time ago, long before this live stream started, you can't treat the patient who does not want to be treated. I think he said it differently in Greek, but that was the ethos of what he said. So you're 100% right, FireMed Chick. Michelle, great to see you. Teresa, Lynn, maladaptive daydreamer right here. Thanks, ADHD. You're not alone, Teresa. You're not alone. So Sunshine asks, almost any addict, ask any addict, and they will tell you they want to overcome addiction but are unable. Yes, that is the definition, like we said. People might recognize the long-term harm, but the inability to hit the abort button is the characteristic of addiction. You're 100% correct. PhotoCan, go into more detail Photocan asks me to go into more detail, and the comment disappeared. Where did it go? Aha. Sorry, guys. I feel like I don't want to say boomer, and there's boomers out there, but I feel like a Luddite for a second. All right. The neurological level, please, for addictions. Heroin, fentanyl occur in a biologic way. How do you say this is also in a psychological nature? Photocan, great question. What's the chemistry behind addiction? Too much for me to go into, and I'm not an expert in the neuroanatomy for exactly what parts of the brain are releasing dopamine to what other parts of the brain. For my work in the operating room, I can only go off of theory for so much. It comes down to the actions for me. I know that dopamine rushes, dopamine surges that are too fast to allow the brain's protective mechanisms to kick in, destroy my patients' lives. That's all it comes down to. What part of the brain is releasing the dopamine and what part of the brain is trying to prevent it? I don't remember from my neuroanatomy in medical school. Most physicians probably don't remember the exact parts. And more importantly, we don't really know as a medical community. What we do know, though, is ways that patients can recognize what's going on, recognize the concept of how susceptible our brains are. Me, you, Dr. Bradley Hay at UCSD, all of us are human. We have this weakness. We are susceptible to rapid rushes of pleasure, sometimes overwhelming our protective mechanisms to prevent addictions from forming. That's a dose of humility, that we all need to take because we're all at risk. Doctors have certainly a lower risk, a lower prevalence than the general population. Even this terrible case at UCSD, which absolutely horrible. I don't want patients to be concerned because realistically, this is very rare. But no matter how high functioning you are, a doctor, a lawyer, a school teacher, on Wall Street, whoever, it doesn't matter. We're all susceptible to it. Dose of humility, guys. Having a dog is like a toddler, says Fire Met Chick. You're right. Okay, we're closing in here. We'll need to continue. I'll try to finish off some of the questions here. Jay, if someone is a habitual breath holder, shallow breather, it becomes a normal breathing pattern. Taking a deep breath is very uncomfortable. It almost hurts. It hurts, causes anxiety. Yeah, Jay, you hit it on the nose here because when you reinforced it very well for everyone here. Your experience of rapid, shallow breath breathing becoming our habit loop that we sink into in stressful situations when those addictions are more likely to show can sink our cardiovascular health, our vagal tone, overall contribute to exacerbating and worsening anxiety. You're totally right, which is why it takes time, right? And the last thing I want any patient to experience is disappointment, feeling like a failure, feeling like I tried doing this for 5 days and my breathing is still rapid, shallow when I get nervous. It's okay. That's the expectation because it may have taken you years or decades to reach this point where your cognitive loop is rapid, shallow breathing. It's going to take a little bit of time to replace that loop with something else. You can't just cut it out. It's very difficult because you end up with a void, and voids like to be filled. The human brain likes to fill voids, but you got to fill it with a bigger, better offer, something better, like instead of rapid, shallow breathing, 5 in, 5 out breathing, 4, 7, 8 breathing. It will happen with enough practice and with the right guidance. It's why I have that ketamine infusion clinic to help patients grease the wheels, if you will, to recognizing the cognitive rigidities that they bring in to their disease and their suffering so that they can recognize it and to begin to replace it with a bigger, better offer. Open a door to a new way of responding to stress. Open up a new door to how they view themselves so that when that stressful scenario comes again, because it will happen. It'll happen to me. It'll happen to Karma. It'll happen to everyone, you included. But when we have access to an alternative way of looking at a situation, an alternative way of having our cognitive rigidities not hurt us and be maladaptive, but help us, raise us up, that is when we can bring our health to a level that no medication can. None of the antihypertensives, etc., that I could ever prescribe will ever do the same as what you can do within yourself because of that innate healing potential that we all have. So I want to leave that with you to end our holiday weekend here. You have more power over your health than you've probably ever been told. For those of you who I did not get to your questions, Sergey, so good to see you. Michelle, you'll hear the ringtone again, I'm sure. Uh, Teresa, you're absolutely correct about eating being an addiction. Absolutely. And religion and mental health issues, metrolismo. Yes, that is a huge one. Spirituality. Dr. Lisa Miller's work is so powerful for exactly what you're saying. We will talk about all these on the next live stream. I hope everyone learned something. Do please hit that like button if you learned something. Share what you learned with others. Your support helps me do this more often and helps you also keep up with when I go live so that you can get a chance to answer more questions. As always, you have more power over your health than you've probably ever been told. Until next time.